rates being high throughout DuPage County, that we are very careful with keeping the disease controlled, preventing spread. So that's why containment and mitigation strategies are essential to keep our schools open. Containment basically means the whole isolation once you actually get the virus, the quarantine if you've been exposed to the virus. Mitigation is more things that we can do at school, like masking and social distancing, to keep ourselves as well as our students safe. So, just briefly, if somebody does get COVID, what we do is we ask them to isolate, meaning that you stay home for 10 days. You have to be fever-free for at least 24 hours. And the 10 days starts from when symptoms start, or if they don't have symptoms, from when they tested. And then, if you are feeling any symptoms and you're not sure if this is COVID or not, it's best that you stay home and you get tested, because you don't want to expose others, cause spread of the disease. So just, another part of containment is the quarantine. And I'm not going to go through all the details here that I have listed, but, it's important that, if we're in contact or close contact, basically, which is considered if you're within 6 feet of somebody for 15 minutes in an indoor space over a 24-hour period within 2 days of when they started symptoms, you need to actually quarantine if you're not fully vaccinated. So that would be our kiddos mostly who are not vaccinated. So they would test immediately if they're exposed. If they're negative at that test, they test again at 5 to 7 days from the last exposure to the person that had COVID. And then they need to stay home for the full 14 days if they're not vaccinated and they were exposed to somebody with COVID. Now, if you are vaccinated, like most of us, especially since the staff and volunteers are mandated to be vaccinated, then you just need a test at 3 to 5 days after exposure. And then you continue to wear your mask at all times when you're in indoor settings for 14 days, but you don't have to quarantine if you're asymptomatic and you're fully vaccinated. And then there's, further details as to if you had tested positive for COVID, then there's some other, we don't have to quarantine if it's within last 3 months. I won't go through all the details here, but there's lots of, this is part of containment to control the spread of disease. Now, mitigation is what we're focusing on really in the classroom, and that's going to be the masking first and foremost. So CDC recommends universal indoor masking by all students 2 years and up, all staff, teachers, visitors, K through 12th grade, regardless of vaccination status. So we have to make sure that the masks are worn properly. So you can look at the image. You want to make sure the mask comes over the nose, under the chin. If there's a metal part to the mask, you want to pinch it so it's on tightly. You don't want a loose mask where there's space on the sides. So just make sure that you're taking a look at the students as well, because they're not vaccinated, making sure that their masks are on appropriately, fully covering their mouth and nose, and a proper fit, because that's how we're going to prevent spread again of the disease. We want to try to maintain a 3-foot physical distance between students within classrooms to reduce transmission risk. And this is per DuPage Health criteria, that the recommendations that I'm going over. And then vaccination is the leading public health safety strategy. So you want to keep our schools safe by having all the teachers, staff, volunteers vaccinated. Kids over 12 are eligible for the vaccine, and hopefully even the younger kids, the vaccine will be coming soon. It's promising. Kids are not being mandated right now through ICN to be vaccinated, but they can be encouraged because it is very safe and would help keep their families safe, themselves safe, and their communities safe. Just a quick story you might have seen in the news recently. A teacher in California had took off her mask to read to children for about 25 minutes. She came to school. She was a little tired and had a runny nose, but she thought it was her allergies. She ended up being COVID positive, and about 26 people were infected because she took off her mask and read a story for 25 minutes to the children. So again, just a reminder of how important universal masking is and how important it is for us to keep our mask on at all time, as well as the kids too. Other parts of the mitigation strategy include self-certification, which, ICN is doing a wonderful job about. Hand washing is very, very important. So I would recommend, even when kids come into the classroom, you could just have them hand sanitize, because now they might have been touching their face and things beforehand, putting their mask on. So now that their hands will be, clean, touching the surfaces, there's less probability of passing a disease one to another if they wash their hands or hand sanitize as soon as they come into a classroom. When you do wash your hands, we do recommend that you use soap and water, and that you clean for about 20 seconds, especially after coming from a public place. If you're blowing your nose, coughing, sneezing after the restroom, or handling your mask, those are the recommendations by the public health department. So respiratory etiquette's also really important. So if a child has to sneeze or cough, they should be doing that into a mask. Obviously, if they are doing that into the mask, it's good to have extra masks, and they, can change their mask into a clean mask and then wash their hands afterwards. Cleaning and disinfecting is also a very important mitigation strategy. So if there are surfaces that are commonly being touched, high traffic areas, it's good to kind of wipe those down, and that will decrease the rate of transmission between children as well, especially since they're unvaccinated. I'll take a chance again to kind of promote and encourage everybody who's 12 years and over to get vaccinated. It really helps protect our communities, protect our students, protect our families. Next, I'm going to spend a little bit of time talking about allergies and going over how to use the Epi Pen and when to use the Epi Pen. So food allergies are very, very common. They can be potentially life-threatening, and that's why we're talking about this today. The most common food allergens are going to be peanuts, tree nuts, milk, eggs, wheat, soy, dairy, and fish. Even though we're not eating right now in the classrooms, I think the Arabic class after that, they may have a snack, and then they have, they eat before coming in, and you can have a reaction minutes to hours after ingestion of the food. So symptoms may not show up right away. Usually the most severe symptoms do show up sooner after ingestion, but they can show up a little later. So it's important for us to be aware as teachers and providers of which students in our class have allergies, and what we need to be looking for in case we need to use their emergency medication that will be located in their bag. So symptoms include, they go from mild to severe when you have an allergic reaction. They include itchy red bumps that are called hives. So I have a picture on the side, and the kid on the top has some angioedema, some lumps, some lip swelling, as well as some hives on his body. The picture underneath shows hives on the body. So one of the most common reactions we see is in the skin, and we see hives pop up. If it's just a few hives, that would be considered mild, but if it's diffuse hives throughout the body, that would be considered a severe reaction, or especially if there's a combination of systems being affected. So if you're having the swelling, the hives, or shortness of breath combined, that would be considered a very severe reaction. So other things to look out for would be, recurrent vomiting. That can also be a sign of allergy. So if you have a child, again, who comes in who has known allergies, especially, and he's having recurrent vomiting, you need to think in the back of your mind, is this anaphylaxis, or is this a severe allergy occurring? Of course, shortness of breath, wheezing, difficulty breathing, lightheadedness are all part of symptoms of severe reaction. So anaphylaxis is the term that we use when you have the most severe reaction. And that really focuses more on that you stop breathing, your airway can close. So I want everyone to realize how severe allergies can be and how life-threatening that they can be. That, this child may stop breathing. And timeliness, I cannot stress enough, of administering the EpiPen is extremely important, because you won't be faulted if you gave it too soon, but if you waited too long, it could be a life or death situation for that child. So again, anaphylaxis symptoms I have listed out here: trouble breathing, noisy breathing, hoarseness, fainting, turning blue, pale, swelling of the throat, of the face, lips, tongues. In each of the bags, so this is what you're going to do. If you identify that the child is having severe symptoms that look like anaphylaxis, like the ones that we've gone over, The child is going to have a food allergy action plan in their bag as well as an Epi Pen. And if you need a reminder, this is what that action plan looks like. And it goes over what are severe symptoms and what are mild symptoms. You want to inject the Epi Pen right away if you notice that they're having severe symptoms. You want to call 911. When you call 911, you want to tell them that Epi was injected. You want to consider giving Benadryl or an inhaler if they have that in their bag as well. You want to put them in a safe position. You want to lie them down. You want to raise their legs, keep them warm. If they're having difficulty breathing or vomiting recurrently, you want to put them to the side or sit them up. You want to alert their emergency contacts and administration. If you don't notice improvement after 5 minutes of giving them the Epi, you can give them another dose of Epi if that is available in the bag. A lot of times we do recommend 2 Epi. So if you have another one available, you can give a second dose while you're waiting for 911 to show up. Again, if they're having mild symptoms and more than one system is affected, you're going to go through the protocol that I just went through with giving Epi and notifying administration. If it's just mild, just like a few hives, a mild reaction, a little bit of an itchy throat, you can give an antihistamine like Benadryl, which should be in their bag as well. You can stay with the child, alert administration. If you notice that the child is worsening, obviously, then you're going to give Epi and go through the other protocol I went over. You want to make sure that, of course, you're alerting the emergency contact as well. Now, just briefly to go over how to give Epi. So the most common form of epinephrine we're going to find is an Epi Pen. It may be the brand name, it may be the generic. Just as in the picture, you want to hold it with your fist. You want to pull off the blue safety release. You want to hold the child's leg in place. Because remember, now this child might be scared because they've probably, if you're giving them Epi, they probably are somebody who has severe allergies and have needed it before. Sometimes they're crying, screaming, moving around. So you want to hold their leg stable. And then you want to firmly place the orange end against their outer thigh and you hold for 3 seconds. 1, 1,000, 2, 1,000, 3, 1,000. You push down hard and then you let go. The needle retracts, so you don't have to worry about poking yourself. Remember, you don't have to remove their clothes. You can go right through jeans, right through whatever they're wearing when you're giving the Epi Pen. Always remember to call 911 if you are needing to use the Epi Pen. And if you're deciding whether to give it or not, again, it's better to err on the side of caution. So if you feel like symptoms are pretty severe, you're not going to be faulted again for giving it. But if you don't give it soon enough, you may run into a problem. So try to give it in a timely manner as soon as you identify that the patient is having severe or mild symptoms in at least 2 systems. ABQ is another common one that you may find. So this one is nice. It actually talks to you. You're going to pull it out of the cartridge, you pull off the red safety guard, and it'll really talk you through everything if you don't remember what you're supposed to be doing. And then you place the black end against the outer thigh and you hold for 5 seconds. And again, you let go, the needle goes back in. You don't have to worry about poking yourself. It's very easy to use. Maybe we can provide some of the training devices in the office if you wanted to come and try and use the trainer devices to be comfortable using both the Epi Pen and the ABQ auto injectors. Praying that everyone has a safe and healthy year. I'm excited that everyone's back in school in person. If you have any questions, I'm here to answer some questions. Thank you for joining us.
Jazakallah khair, Dr. Khan. As always, I know you've been here many years to give us this training. As always, it was very thorough. It was excellent. I know every year I always learn. I get great reminders and I learn a lot of new tidbits as well. So thank you for that. I'm going to check the chat. There was a question about the dose of epinephrine. So if you can just speak to that.
Sure. So the Epi Pen comes in 2 doses. There's a 0.15 milligram for kids typically that are less than 30 kilos, and then there's a 0.3 that's above 30 kilos, but the doctor should be prescribing the correct amount, so you don't have to worry about dosing it. The dose is already loaded into the device, so you're just going to administer the dose that's in their bag.
Perfect. I have one more question, and then I know that staff do not drop off. I do have 5 minutes of slides as well that will go over some Al-Falah protocols. Just some are quick reminders, some might be new. So just hang in there for about 5-7 more minutes. One question that I wanted to bring up is, I know this has come up in the past. Someone had asked, if I inject epinephrine and the child looks fine, do I still need to call 911?
Anytime you inject epinephrine, you have to call 911.
Okay, perfect. All right.
Assalamu alaikum. I had one question real quick. So, just to make sure, each child that has allergies has an Epi Pen inside their bag, right? With like the data sheet.
Yes, good question. So I'm actually going to jump now to my slides. And then if any more questions come up, I know Dr. Khan is still here. So she can definitely answer those as well if questions come up. I'm going to share my screen.
Okay.
All right, let's see. Can you guys see my screen?
Yes, we do.
Perfect. All right, so Brother Eamon, I'll get to your question in a second. I'm just going to go through these slides and your question will be answered, inshallah. So we just heard from Dr. Khan. I'll go back to that slide. She's a local pediatrician. Again, her children go to the school, and I don't know how many years she's come as a volunteer to give us this training, but we're very grateful for her knowledge and her presence year after year. Sister Sayeda Azam, also known as Sister Bailey, she's always been on our security team. She is now our COVID response team lead. Her duties, in case you have any specific questions, she tracks the self-certification that comes in monthly. She tracks their absences and the 6 students that come downstairs. So if you're ever bringing a student down to the main lobby, you're looking for Sister Sayeda or Sister Bailey. That's the individual that you need to look for. She'll take that student to our health table, which currently is right by the front main door entrance. So far, we have medical professionals that signed up to volunteer at that health station. So inshallah, we will have a medical professional each week to assist with evaluating students as they're brought downstairs. Sister Sayeda also communicates with parents of these students to gather self-certification, a negative PCR test, or a doctor's note. So if the students are sick, if they came down sick, or if they're absent and they mark that they were sick, they are not allowed to re-enter the school the following week. Even if they feel better, they need to submit to us a negative PCR test, the COVID PCR test, or a doctor's note that says, this is not COVID related, it's, these allergies, or, whatever the situation may be. She stocks our masks and our sanitation supplies for the school and our teachers. She organizes and manages the health professional volunteers. If you know any parents or individuals who would like to volunteer, we did just send out that link again today. It's in our principal email. It's been in our principal email each week. And then again, she manages our health station at IC and Al-Falah Academy. It sounds very official. You guys know Fisher. So it's a table and about 2 chairs in the front of the building, but it is a wonderful health station. Our Al-Falah allergy protocols. So all students with allergies in your classes have been identified on the teachers' rosters. So on the first day of school, each teacher was given a roster that has students who do not want to be in pictures or posted on social media, students who are not allowed to go outside for class, and then students with allergies and specifics as in terms of what are their allergies. Is it peanuts? Is it tree nuts? Is it, birch trees? That sort of thing. So all of that should be listed on the teacher's roster. So if you're a TA, ask your teacher when you get to school, can I take a look at that roster so that you are personally aware as a TA also which students have allergies. You can keep an eye on them also. Arabic levels 1A and 1B, like Dr. Khan mentioned, are currently the only classes allowed to have a snack after their Arabic classes. That snack is brought from home. The reason it's only those two levels currently is because we're only allowed 50 individuals per space. So if we had all the Arabic levels eat a snack in the cafeteria, it would be over 50. If the transmission levels are reduced in the district, we can have all of our Arabic students have a snack. We've asked for the snack to be peanut and tree nut free. Those are our main allergies that we've noticed. If there are other allergies in those two groups, we will let those families know. Students must sit socially distanced when eating. When you go in the cafeteria, you can see the X's on certain seats, so students are not supposed to be sitting on those seats. And then students should be given assigned seating in the lunchroom. So we've talked about this, taking a picture of the students while they're eating, so you know exactly where they're sitting in case an issue arises. But if you can give them assigned seating from the beginning and keep it that way, I think that would work best. So for those Arabic teachers that are on right now, please keep that in mind. Maybe you can start that this Saturday, inshallah. Any student with an allergy should bring his Epi Pen. This is to answer your question, Brother Eamon. Should bring his Epi Pen, inhaler, and or Benadryl to school, and his allergy action plan. So in Dr. Khan's Google Slides, her presentation, she had a picture of a paper document that the one I know for my personal, from our personal family, my son's action plan looks like that. Sometimes they're just kind of typed up, but it goes through, the child's allergies and symptoms to look out for, mild and severe, just like that document said. So that is helpful as well. If you're confused, you can try to pull that out. Hopefully the child has that in their backpack as well. So students and families are told to have their medication on them in their backpack at all times. So for Arabic, again, they should have their backpacks in the cafeteria when they're having their snack anyway. So inshallah, that's a good thing, so that their meds are there if needed. Again, our students, students sometimes sneak things in their mouths even though they're not supposed to be eating in the classroom. Like Dr. Khan said, allergies can present hours after they've eaten. So maybe they ate something at home and an allergy can present. So all teachers, again, need to be aware of, what to do in the case of this emergency. If there's an allergy issue, obviously, take care of the student. Like Dr. Khan mentioned, if epinephrine needs to be given, please go ahead and administer that ASAP. But also send your TA. If it's an older classroom, you can send a student down to get an administrative individual so that we can assist. We can access parent phone numbers and notify them as well, and call 911. For COVID, a lot of these strategies we already discussed in our teacher training. Just quickly going over it, self-certification. Sorry, I didn't edit this, it's monthly. Our next self-certification form for October will go out on Sunday, inshallah. All absences, including staff members, must be monitored. So you need to fill out this form, even if you're a staff member or a student needs to fill out this form, whether you're sick or whether you're gone because of a soccer game or whatever it might be. You must wear masks, you must social distance, you must adhere to cleanliness etiquette. No visitors or parents are allowed in the building. social distancing issues and also self-certification. They need to be self-certified to enter. And all staff members must be vaccinated. We know this. We've received your forms and information. We've hounded all of you before school started. Just FYI, for those that are not currently vaccinated, I do have that data. Our goal is to make sure each of you have your first dose before October 31st. If that doesn't happen, we will have a separate conversation with those individuals to see where we can properly staff you, so that we reduce transmission, make it safe for everyone. Mitigation protocols for COVID. Again, if students are not feeling well, send them down to the front. We had this on the first day as well. We had some students that were coughing a lot or sneezing a lot. If you're concerned, send them down to the front. Inshallah, our medical expert will evaluate them, will contact their parents, and most likely send them home, just because of the uncertainty. Here's something that we didn't talk about in the teacher training. This is our AFA Health Form URL. It is also in the description of all of your WhatsApp groups. It's been added. It's very similar to the discipline form. Every time a student comes down for a discipline issue, there's a discipline issue, or every time they come down for a health issue, you need to fill out this form. We need to track this information. And again, this year is so important to track this health information for the safety of everyone in the school. And then each month they need to self-certify. And if some of you noticed last week, we did pull students from classrooms if they were not self-certified. So technically they should not be in the school if they're not self-certified. So we'll pull them out every now and then. You might be seeing that, and then we need to call parents. So Jazakallah khair again. Like Dr. Khan said, may Allah keep us safe and healthy this year. Inshallah, with all of your support. Trying to stop sharing my screen here. Let's see what happens. With all of your support, this will be a wonderful year. Inshallah, we all stay safe and healthy, and we get to do what all of you do best is teach. Any questions now that I've gone over our school protocols?
Assalamu alaikum, sister. This is Sister Sadia,
Welcome.
Quran teacher. I have a question, like a TA or teacher should check the bag of students carrying the Epi Pen first thing in the morning.
So there's no need to do that. The parents should have sent the medication with them. If you are concerned as a teacher, you can reach out to the administration, and we can notify the parents and just remind them that if your child has an allergy, that please send medication with them. But there's no need to check it on a weekly basis.
Okay. And my second question regarding the second dose, if the first dose doesn't work and still time and 911 call is made and still has not arrived, second dose must be administered. But if there is no second dose, admin would take care of it.
If there's no second dose, then it's okay. You just wait for 911 to arrive. But if there is a second dose that's provided, or if there was, I don't know if there's a backup one that's in the office, it could be administered. But sometimes they have one of the dual Epi Pens that are prescribed to them. So if there's no second Epi Pen there, then you just wait for 911 to arrive.
Okay. And my third question is regarding COVID. Like if a student shows symptom and have sent home and then showed up next week, so should inform the admin and send the student to admin?
So that's not necessary either, because during the week, Sister Bailey, Sister Sayeda, she is contacting the parents. So if the parents have sent us a negative COVID PCR test or a doctor's note, then that child is welcome to join school that following Saturday. If they have not sent that in and they're still in the classroom, Sister Sayeda will be coming to the classroom to check, and she will pull that student out. So there's no need for you guys to manage that. Inshallah, we have that under control.
Jazakallah khair. Aslam.
Welcome, Sam. Thank you. So I have a question for Dr. Khan. If
Sure.
we have an Epi Pen that is expired from, like, let's say I have a 2020 Epi Pen, is that still usable? Or is that something that we, like, let's say you take out an Epi Pen and it's expired?
So I would say that you should have an Epi Pen that is not expired. So we should be, I guess, checking to make sure, or the parents should be reminded that the Epi Pen should be a valid Epi Pen. Now, if a situation arose where somebody was having anaphylaxis and the EpiPen was a few months over date, I would say go ahead and use it. But I think we should be very aware and cognizant of the expiration and try to make sure we have a valid EpiPen.
Is it detrimental to use an expired Epi Pen, or it just may not work?
It may not work as well. So I don't think
Okay.
there's any properties that would make it dangerous, but it may not be as effective as if you had one that wasn't, from what I know. But we always recommend people to have a, of course, an unexpired EpiPen.
Perfect. Let's see. Yeah, there's a question that each Epi Pen is only one-time use. If you need to
Yes.
administer a second dose, you will need a second, yes, you will need a second Epi Pen. Is that correct, Dr. Khan?
Yes, absolutely. So each EpiPen can only be used once. It has the exact amount that's needed. It's, a self-injecting full dose is there. You don't have to calculate any dose or drop anything. So, and it's only used once, and once it's used, you throw it away. And if there's another dose that was needed, that would be using a second EpiPen, because once it's used, the full dose is administered. And there. Any other
Perfect.
questions? Yeah.
So another question is, let's say there is, a child and they needs an Epi Pen, and the teacher knows that, someone else in the class might have an Epi Pen because they have allergies, and they find an Epi Pen. Can you use somebody else's Epi Pen or another Epi Pen on that child?
I would say in emergency situations, if you're pretty sure that that person's having anaphylaxis, that may be a possibility. I mean, the best would be if we had, a backup in the office, which I know that we don't at the moment. You would just have to be, or at least again, in emergency situations, things are different, but otherwise you would want to try to make sure that you're using, for example, if it's a younger kid, an EpiPen Junior versus an older kid, a regular EpiPen. So kind of judging the size of the child to see if you're dosing the child appropriately. But at the end of the day, if somebody was not breathing and is blue, if you were to administer whatever you have, would be better than nothing.
Okay, yeah, and I know there was a concern about students bringing different backpacks each week. I think that's a valid concern, and that's something that, maybe we should put in the principal's email, that reminder for those who have allergies or who are sending medication in backpacks. So I will note that to remind parents.
Mm-hmm. Are we going to do this year again? I think you had like a tag that kind of signified which bags had medication in them from last year.
So yes, so we did do that in previous years. We noticed that we gave the tags to families, but not every family put them on the backpacks.
Mm-hmm.
So that is something that we haven't put in place yet, but we're still discussing. But this year we did give all of our teachers a roster from day one with the students with allergies. Any other questions? Did I miss any questions? Okay, so if a student gets the greater dose, but he's supposed to have the lower dose, is it dangerous?
So side effects, for example, when you give the Epi Pen, okay, would include that your heart starts racing. You might become a little jittery. So you may see that a little bit more exaggerated in somebody who's given a higher dose than what they need. But again, if that's all you had, it would be better to do that than to not give it.
Perfect. At least we should, all this week list students who should have EpiPen. And okay, perfect. Yeah, we got a comment, internally that we should, check who's carrying medication and see, how many are missing. So yeah, definitely. I'll write that. I'll note that. Any other questions? Someone had asked a self-certification question. We're self-certifying monthly. So the first self-certification form that went out was for September. The next one that goes out on Sunday, inshallah, will be for October, and that's per District 204 guidelines. So they're self-certifying monthly as well. Yeah, can a school get an Epi Pen like airlines have? I've tried. I don't know, Dr. Khan, if you know the route to getting an Epi Pen for a school.
We can work on it. We can work on
Okay.
it.
Any other questions? All right, it's about 8:18. I know I promised an end time of 8:15. Again, thank you all for being here. This is a really important presentation and training. Thank you again, Dr. Khan, for your time and your efforts. May Allah reward you. And yeah, Jazakallah khair for being such a great support to our school.
Thank you for having me, and good luck with this school year, inshallah.
Thank you. All right. Assalamu alaikum, everyone.
Assalamu alaikum.